Welcome to Sports Doc Talk. As you can see, we have Dr. Grant Garcia. I'm Will Sanchez. Dr. Garcia, unbelievable. It's the end of the year. We're wrapping things up. And before the year was over, we wanted to make a mention of some key injuries looking at 2025, even though 2024 Major League Baseball season just ended. But with the winter meetings concluding, so many players out there. If you are Juan Soto, you just got paid, baby. So
For
that's a
life. He's
beautiful
not going to
thing.
be playing anywhere else.
Oh my God, that is absolutely amazing, Gary. Listen, there's over 3,000 Division I players in the transfer portal in college. Forget football. Go learn how to throw a curveball, hit some line drives, hit some home runs, go get paid, go get that baseball money is guaranteed. I think I'm gonna start having babies again. You have some young ones. Maybe your wife needs to hear this episode and let's get
Oh my
some babies
God.
back on. Let's get some baseball players. You're an athlete. Am I starting trouble? I don't know, but there's money out there. I'm
Dude,
really excited as
that's
you
a
can
lot
tell.
of money. That's a lot of money. Holy cow.
Well, before we get to these key injuries as we look forward to 2025 for the baseball season, holidays. Maybe I should whisper this. Maybe we should keep it quiet. Did you do your shopping? It's the end of the year. Did you take care of the shopping? The kids taking care of, wife taking care of. What's going on? This is a safe place. You could tell us. Shh, you could tell us.
Everybody knows that I'm too busy to do that. There's no way I'd be capable of physically doing that. There's my wife sent me a little Instagram meme, and it shows this little squirrel that's like very excited and looking around. It says that's what dad looks like on Christmas because he's never seen the presents either.
Yeah, that's messed up. well, thank
So
God
I do
Amazon
my
and all
best.
those companies.
I do my best what I can, but unfortunately the boss of the house is in charge, and there's no way my gift would be good enough anyway, so it might as well just let the boss deal with it.
A smart man. That's exactly what you should do. It's like you pick out what you want, and then we'll all be surprised on Christmas morning.
Yes, precisely. I like it because it's like for me, it's like Christmas as well. I get everything surprised, so it's very nice.
Yeah, and for those that have listened to the show, if you need some travel plans, Dr. Garcia is the travel master. So you will coordinate all the vacations, all the travel, and the
I
wife will
know.
take care of all the presents and make sure that everyone's having a wonderful holiday as we wrap up the year. I think that's a good plan right there.
Absolutely.
All right, let's move on because if not, we're just going to keep going. I do this all the time. I apologize to everyone. The Dodgers have wrapped up the World Series. They defeated my Yankees, which was just tough. But, they've got a squad. They've deferred over $1 billion, and God knows what's going to happen going forward. But one of the star players on their team got injured, and one of the star players, most recognized players in the world, Shohei Ohtani. He had orthoscopic surgery to repair a labrum tear in his left shoulder, right now his right, that he sustained during the World Series while he was sliding to second base. And you can explain this, right? The surgery known as, was it Bankart shoulder repair, involves
Yeah.
reattaching damaged ligaments to the proper position in the shoulder joint. So I hear a very specific shoulder repair. So you got to tell me why it's called that. But also you're using ligaments to put the shoulder back in the proper position. So what happened with this injury and what does this all mean?
Okay, so we talked about shoulder dislocations before, but when he slid into the base and dislocated his shoulder, basically when you dislocate your shoulder, you're pulling the shoulder out of the joint, and there's a suction seal on it called the labrum. And I draw this for so many of my patients, but imagine my hand like this. I'll try my best if I can do it, and it's probably gonna be best like this. So there's a suction seal around there called the labrum. He tore the labrum. Generally, when you dislocate your shoulder, it's out the front. So front and inferior. So an anterior inferior tear. That front anterior tear is called a Bankart tear from, you'll never guess, Dr. Bankart. He described it first. Genius. So
Genius.
it's called a Bankart repair, but basically you're repairing that anterior labrum. And there's various versions of this. Trevor Lawrence had a tear like this, but it was much bigger. It went all the way around. Remember them bragging he had a 7 or 8 anchor repair. you know, there's been a few of these types of injuries before, but this dislocation, pretty much, people always ask, how do you know it's torn? You don't even need an MRI to really confirm this, because when you have a dislocation, almost always this labrum's torn. The question is whether he's had it before. Probably not.
Yeah.
Why they did it in the first try, it's probably because, now this is interesting. So this is actually the bigger point here. If he's never had dislocation before, it's his first one, right? So fixing it's almost a little bit controversial. Now there's more. We used to tell people, and I just had two patients today that I talked about this with. We used to say, you can dislocate your shoulder a bunch of times. Who cares? Just deal with it. We've talked about this before in the season. You know, the in-season athlete, what do you do with them? Dislocate your shoulder. But to be honest with you, we're getting more and more data to show that we should really be fixing these patients right away, because the longer you wait, you get glenoid fractures like Deshaun Watson had. You get lose bone, and then this simple Bankart repair that was done is no longer an option. And so I think what happened is it was probably as a result of the timing. I think if he had dislocated his shoulder in the middle of the season or in the beginning of the season, he would not have gotten surgery. But it's that classic like NFL thing too. You know, as you hear about the players, you're like, that player wasn't injured, and then all of a sudden they got surgery at the end of the season. They probably said it wasn't worth the risk. There may have been more to the damage than we thought, because it's still fairly aggressive to do it, especially on the non-throwing shoulder. The swing in the bat by February, I think, is reasonable. He injured this in November, right? Or October, end of October.
Yeah. It would, it would the end of October. Yeah, middle.
Yeah. So we got surgery. He probably got surgery within a couple of days, because he just calls his buddy Alatrash.
Yeah.
You know, the same guy did his elbow. So he's going to be 1, 2, 3, 4 months. I mean, usually full return for one of these, your full return 4.5, 5 months, 5.5 months. That's back to everything. So his swinging, they said February, probably March, and he'll probably be ready for the season for pitching. Again, it's his non-pitching shoulder. But
it will be his lead swinging shoulder if as a left-handed hitter, right? So I mean, that is your pull. So
yeah, but that doesn't.
There's no concern when it comes to that.
I mean, his power is going to be from the drive, right? The follow through is important, but he's not going to dislocate his shoulder following through with the bat, especially after one of these. This is a very bad thing for a pitcher, but thankfully it wasn't his pitching side. So,
okay. So if it was,
that would be kind of not, that would not be good. This is
plus he's coming off an injury already from pitching as well.
I mean, the question you have, obviously he played amazing, but what is the longevity now? This is his second surgery on his body in the last few years. Granted, obviously this is, unfortunately the part of the game for some of these players.
Yeah.
But this is another procedure he underwent. He'll be back. This is not something it's not a small procedure to do.
So this type of procedure, if it was whatever, the dog days of summer, right? June or July, if this would have happened, then this surgery probably wouldn't have happened. They would have treated something very differently, or because maybe if there would have been something more severe, then you go, well, we have to go in and fix it and not just be as dismissive as we're just kind of fixing that labrum.
Yeah. Like Deshaun Watson type of thing. Or there's something called a Hill-Sachs lesion. So he has a big one of those, or this wasn't his first one. We don't know that. Probably his first one. I feel like we would have heard about this before. And the mechanism was so traumatic. Like generally when people have multiple dislocations, they don't dislocate it traumatically. It's like, oh, I dislocated my sleep. I dislocated like putting my arm over my head. So it was probably his first one. And there was probably a little more damage than we're hearing about. And it's him. So he's worth a lot of money to the Dodgers.
Oh yeah.
So they have no interest in him being out next season.
Yep.
They probably made a game time decision. Yeah.
All right. So hopefully he'll get back, unless there's some complications. And if they are, we'll be back on here talking about it. So that's a plus for us then. But I don't know. That sounded a little selfish.
Yeah, it's a pretty low risk. It's a pretty low risk surgery, and Elatrosh does a good job. He'll be a very low chance of him not getting back.
Gotcha. You have your Atlanta Braves logo behind you, and I apologize to any Braves fans, but it seems like some of your best players got hurt this past season. And if you're a fan of the team, you know that firsthand. You don't need me to tell that, because there were so many key injuries, and that's going to be some NL East race now with Lindor and Soto and with the Mets. And then hopefully they get guys back like Joe Jimenez, the Atlanta Braves key reliever. He had surgery to repair the cartilage damage in his left knee. And the surgery was performed by, your buddy, Dr. Brian Cole, on October 29th, 2024. He's expected to miss roughly a calendar year. They're saying 8 to 12 months, which is a big blow to the bullpen. He had a fantastic ERA at 2.62. So a couple things. October 29th, 2024 is really, the season's over. Yeah. So is this something, when you hear about an injury like this and when it happened, when you're having surgery, how the length of it, what do you think that process was? And we're dealing with hypotheticals here, but what do you think happened there with this pitcher where they realized that he had to go get this repair the cartilage on this knee?
So, this wasn't a spur of the moment decision. This was probably planned, right? It's the same thing as what we talked about before, is at the end of the season, you have a string of players. When you take care of the professional teams, then that week after is like open season, right? You got to fix everybody up, get the team ready to go, because it's the maximum amount of time for recovery. So this was a planned surgery, likely. Nothing we heard about, and obviously he wouldn't have played so well if he had been, it had been something he had to get done acutely, right? So it clearly was bothering him enough to get this done. 8 to 12 months is a long time.
It's a long time.
You're looking at probably a more advanced cartilage surgery.
Okay, right? So break that down. What do you mean advanced?
So again, the problem you have with some of these layman terms they put in here is they try to dumb it down so much that unfortunately it's hard for someone like me to really diagnose it. Like, the Lonzo Ball thing, we had to hear multiple rounds of injuries.
Yeah.
But this is bad enough that Brian Cole had to get involved.
Yeah.
Now there's some more minor procedures that he can do. So we've talked about like biocartilage, where you can kind of microfracture that area and you put some juvenile cartilage. There's some newer procedures out there that he may have done for him. 8 to 12 months, in my opinion, is like a cartilage transplant, which we talked about with Lonzo Ball. So, maybe Dr. Cole is getting more brazen with the cartilage transplants because he now has done a few of them. He did the professional hockey player recently. He just did Lonzo Ball. And now all of a sudden, maybe this is like I told you, what did I say in the last podcast? I said this could open the floodgates for more and more of these surgeries. So I wouldn't be surprised if he did something like that, like a cartilage surgery. They may not announce it anymore because it may not be considered hot news, right? I've had a few of them in the MLB. So it's like, oh yeah, you just had a cartilage transplant, no big deal.
Yeah, that's really concerning. Ronald Acuña Jr., he tore his left ACL in May. He's expected to be out, a couple months of the 2025 season. So that's pretty much almost a full calendar year. Second major knee surgery in 3 years. So what are we concerned about with his knee, with his health, and maybe what's left in that knee?
That's perfect. That's a lot. Your last comment was very good. Yep. You're gonna get your MD soon at this show. You keep going. So the second surgery is always the word meniscus, right? Probably not cartilage damage. Generally, if that's bad enough cartilage damage, it's less common in these ACLs. When you get it, you're starting to address it, or they're having a lot of pain and swelling, and just the cleanups don't work anymore. The ACL tear obviously needed the surgery, but my assumption is he probably had some sort of meniscus tear that they either fixed the first time or they cleaned up. So now he's had 2 major knee surgeries, and we're worrying, is this going to be a situation like you had with Lonzo Ball, where by the time you're done with him, he's got minimal meniscus left? That being said, when you have minimal meniscus, it doesn't mean you need to be completely out of the season, or you're done for your next 5 years. So it's important to understand that this meniscus injury just could be a blip. Obviously, if it goes into cartilage stuff, that's a problem. But from the meniscus standpoint, we'll just have to see. And hopefully, we all know that when people have these ACL tears and they're reconstructed, the return to sport is good, but the overall longevity of the knee is not as good when the meniscus is gone.
For those who are wondering what the hell happened, I had to get my charger as I'm trying to listen to you, and I disappear. So it's all very interesting, Dr. Garcia.
Well,
But
the good news is that I
yeah.
tried to keep talking until you came back.
He's probably like,
Where did he go?
where's Scott?
I was thinking, I was like, I'm pretty sure I'm done with this. This thing, the podcast is over right now. Will's just told me it's time to leave. He just slowly exits the screen.
Just see that's how you know. End of your episode here. Ronald, we really do care about. We're really concerned about your knee, as you can tell. So
But
sometimes
basically, what we had said, Will, was meniscus damage with an ACL, not as good of a result. Definitely a concern. There's
Yeah.
been lots of data that the time that people go back, this increases the chance of re-injury of the ACL. We want to save the meniscus at all costs. Not sure his meniscus was saved based off hearing all this stuff. And we don't want to turn into Lonzo Ball situation where this turns into cartilage damage. You have a really good young player here. So we'll just see. But again, the age issue with these ACLs is there's always a little secret stuff in there, and you got to figure out if there's anything else wrong and how they're going to do. But generally, these guys do well for a while.
What would be your red flag for you if he gets out on the field next year, starts playing, starts running or swinging, and he complains of certain pain, especially if it's not obvious, if it's something that, okay, he just running the outfield or taking a swing and that torque in that lower body area, and all of a sudden he walks off the field, like, yeah, I'm kind of feeling something. What's I guess what's the next big concern for you now that he's had multiple injuries and surgeries?
Yeah. I mean, I'm always thinking about his meniscus, right? If it's been trimmed or removed, the ACL, you can get re-tears. It's just not that common, especially in baseball players, right? We don't hear about it that frequently that you have someone has an ACL reconstruction and then re-tear it. That's more like NFL, rugby, occasionally basketball, but and baseball players I'm sure can get it, but it's just not as common. So, I worry about like he starts to run and he says swelling, all of a sudden you see him going on the DH more frequently, right? Like those are the things that worry me. The deficiency syndrome where basically you get some of your meniscus removed and you get into a Lonzo Ball situation, it's not that common. So I don't think he's going to have that issue. But if they fix his meniscus, well, if it's a second attempt to fix his meniscus or save any part of it, that can re-tear. That's a higher chance that he's going to have a re-tear of his meniscus if he got it fixed than if he has part of his meniscus removed and he has a problem. It's just a higher percentage, 20% or something. So we'll see. I think he's probably going to do well, but if there is issues, you worry about his knee long term. I mean, the good news is obviously it depends on, he may be able to change positions if he, up to that, but I think he's going to do well with just this surgery alone.
Okay. Staying with the Braves, once again, apologize, Braves. Spencer Strider.
I know, we had to have him up.
Yeah, no, it was just one of those things, and it's a thing that we're just keying on certain injuries, and it just kind of happens to be a lot of those players. Spencer Strider, and I'm going to kind of go back a little bit here, right? So he had Tommy John surgery in 2019. Okay. In 2024, he had elbow discomfort, right? He began to start feeling it in spring. He tried to pitch through the pain. So I want to ask you about pitching through pain, especially when it comes to the elbow area. And then the MRI showed that there was damage to the UCL. And then he had surgery in April 13, 2024. He had the UCL surgery with internal brace. You know how we like that stuff. So with all of the concerns, right? 2019 Tommy John surgery, elbow discomfort. You have the UCL surgery now with the internal brace, which is different than your traditional Tommy John surgery. And I want you to explain the difference with that. By the way, we'll always shout out the procedure by Dr. Keith Meister. That's a pretty cool name, right? Meister. So let's just kind of talk about the differences between the UCL surgery with internal brace compared to the regular Tommy John surgery, and what are some of your concerns and thoughts on that?
Yeah. So the first part I'll make, I think, for any of the doctors listening is obviously, I'm not sure he actually had a full reconstruction, Will. We have to look at it because if you have a reconstruction, you have no more UCL left there or Tommy John ligament left there, so you can't repair it. So I'd be interested to hear if maybe he had like some PRP done to it and they thought it was a procedure on his UCL. So we have to look into that. That's the only thing I'll say from that data that you were given. But let's go through the surgery procedure. So Tommy John obviously is the first pitcher that had it done. We've said this before. We've talked about Brock Purdy. This is a really big deal, and I'll explain to you why. It's not just because of the surgery; it's because of his status and then what was done. So this is surgeons breaking in to the cutting edge material. And this is what I told you guys before about new tech. We said, do athletes get the new tech, right? With Dr. Lou. They are much slower to get the new tech because people don't want to test it out, right? Like the Carlos transplant I told the guys before has been around for years, and we've gotten it better and better and better. And I've done hundreds of them, but pro athletes, very few.
And that's why you made a mention about Lonzo Ball and how him having that surgery, this new tech opens up the floodgates. Go ahead.
So that's where we're going to go with this. So Tommy John reconstruction is where you take a ligament from either the wrist, so one of the palmaris, or you take it from the hamstring, whether or not, because some people don't have this ligament in the palmaris. It's like old cat claw. You can see it right there. Okay. Some people don't have that. So they use the ligament in the knee, and then you do reconstruction. Now we've got some newer techniques we're working on, but generally you're talking about a 12 to 18 month recovery. Right? Okay. This newer procedure, which is maybe not even new anymore, it's almost 5 years old or more. We repair the UCL, this tear. And again, certain tears can get this, not all of them. And then we do an internal brace, which is the synthetic suture we've talked ad nauseum on this. And one of Will's favorite slogans, the internal brace as well. So it's a faster recovery. If it can be done, the results are the same as a UCL reconstruction, but you're back in 6-7 months. Kind of depends on the pitcher, but it's a much faster recovery. Ideally, everyone would do this. When this came out, my number of reconstructions dropped. My repairs went up. I do more repairs now than I do reconstructions. And that's a good stat. You should be doing that because there are so many more there's so many of these you can repair and get the patients back. So reconstruction still has a place, but it's not as high. But what's really interesting for the audience to hear is that this was done on a pitcher. So you hear the word pitcher all the time, but generally before the last few years, they reserved this surgery for college pitchers, high school pitchers, little league, not as common, pitchers, and outfielders and infielders in professional baseball, but not for the pitchers. The pitchers in professional baseball are the highest standard. And as a result, the moneymaker, but at the same point, do you want to test a surgery on a professional pitcher? Do you want to be the first guy to do a UCL internal brace on a professional pitcher and have it stretch out and tear in the first year? Right? It's just devastating. And so for years, these pitchers even though other players were getting, I remember when we were taking care of the White Sox, 7, 8 years ago, the outfielder we did it on was like one of the few, our catcher was one of the first ones that got the UCL repair with internal brace. And that was a big deal, but they had a pitcher tear their UCL and they were like, no way, we're doing a reconstruction, right? Now professional pitchers are starting to get this surgery because the surgery works really well. There's been so much data to show that why were we doing reconstructions just because they're pitchers? If it works just as well on other players, there's no reason why a professional pitcher wouldn't work well for. So the fact that he's getting that shows that one, the doctor is willing to push the envelope, which is great. And two, it's not really pushing the envelope because there's so much data out there for it. But this is what the audience should hear. This is a pretty unique thing, right? That's the first thing I picked up when I heard this.
Yeah. And we talked about it before. It's not just one part of it at that level, right? It's a player, it's agent, it's ownership, it's there's so many factors to where everybody has to, get on board and approve it. And then obviously, it'll fall under the player, and who knows if there's something in the contract, when they do something like that and say, well, we're recommending reconstruction over repair, if something happens. So we're going down slippery slope.
And no, we're not. I know, but it's good. We don't want to go too crazy on this, but like when they go to Elatrosh does what he wants.
Yeah.
No one tells Elatrosh what to do.
Yeah.
But that's not who did his surgery, and that's not who does all these surgeries. Meister and good. I think I think I know him. He's actually a good guy. But the point being is that if you're doing a handful of pro athletes and a handful of college athletes and you're the big name in your area, you obviously don't want to push the envelope too much, but also if an agent calls you and they want, when you take care of one of their players, they're going to be like, you should really do this, right? Like in the end, the
Yeah.
surgeon makes the decisions, but let's be honest, in the pros, this is a whole combination. I mean, frequently when we would do the players in HSS, there would be a trainer in the room watching you do the surgery. Like this is how intense the
Yeah.
situations are. It's not like, you just get to do whatever you want on these professional athletes, right? Everything's this discussion of doing the UCL repair was probably like 6 opinions in.
It's fascinating, but with someone like Strider and some of these other pitchers and the Lonzo Balls of the world, and we're starting to see people saying, okay, let's kind of go this route with some of this. It's not new tech, but it's newer for the players that's being done on. It'll be really interesting because once you start to do more things like that, and you open up the floodgates to do other things and
Yep.
present new opportunities. So
Yeah.
it'd be really interesting to follow along that case this summer, and if everything goes well, that bodes well, not for people 2-3 years down the road, for the season, right? I mean, if they see that this works for the pitcher in the season, obviously we know people get hurt. There's going to be a lot of injuries, and if they can say, "Hey, we could get back sooner and not have that major reconstruction," and it worked for this player, and we have the same agent, or we're in the same Major League Baseball, because that's a small club. We think Major League Baseball, a lot of players. That's very few people that are in that. So
Well,
once one
and
approves
the
it,
agents are all
go ahead.
similar, right? They know they're going to call this one. Who'd your guy have? Who did yours? Right? Like there's so much. I mean, when you have over $700 million invested in a contract for a player,
Yeah.
right? You're going to make a lot of decisions to make
Oh
sure
yeah.
that the contract keeps
Oh
going.
yeah. All right, we got. I got two more players here as we're gonna wrap up. Walker Bueller, well-known pitcher. Just kind of go back a little bit. 2022 Tommy John surgery. Then he had a flexor tendon repair that, along with the surgery. So that was done at the same time, but it added to the recovery time. So I want you to explain why that added to the recovery time. And then last year, this past season, he had hip inflammation, right hip inflammation that complicated his return, and then he was put on IL, and he's kind of had struggles, right, including the reduced velocity and they running out of gas, getting fatigue. So, what are some of the things that you're hearing there as I'm explaining this history pattern of injuries with Walker Bueller?
I mean, unfortunately, we always talk about the players that make it back, but there are players that do not make it back from these surgeries. So this could be just one of those issues. But when I hear the word flexor, that's weird. Now, was it included in the surgery? Because in order to do this surgery, you have to detach the flexors at the elbow, or did he actually have a rupture of it?
Hmm.
Or I don't want to say this, but did he have some complication during the surgery? Right?
Yeah.
When you harvest the palmaris, did you damage another part of the wrist when you did the procedure? Probably unlikely. But it's very weird to have a flexor tendon tear on top of the Tommy John at the same time. So, or did he get it fixed and then it pulled off? Or
They
when they got
said
in there, was it?
repair, right? But we don't know what that means between repair and
Well,
you know.
did he when he tore it, did he tear his elbow and then also his flexors? So he had to have that repaired and that took longer
Oof.
to come back. It just the problem is that Tommy John takes so long to come back from that I just don't understand how it took that much longer. Or I bet he might have complications. Like if he had a flexor tendon repaired in his hand, then it can get some stiffness in that, and then it cannot glide as well. So that could be another issue too. Anyhow, we won't know, but those things
Oh,
that the
that's
hip stuff
interesting.
doesn't bug me, but
That's
the
interesting
flexor does.
because I was thinking about the how even rehab could play a part in that, right? Whether if it, rehabbing the elbow and rehabbing the hand, the strength, and what's not working, and dealing with those
Yeah.
things. So that's kind of interesting. The big one for me is uh, the phenom, the Japanese pitcher phenom that's going to wind up going to one of these teams in the offseason.
Will, you're muted.
I don't know how that happened. It's just going to be a lot of
It's one of
editing.
those. You got no. Don't edit it. Show them that we're normal. We have
It's
to keep.
going to be, I don't know what happened. I didn't even touch anything. Anyway,
Nope.
so Roki Sasaki, Japanese phenom pitcher, 2023 oblique injury, right? So that's always interesting. He was limited to 91 innings because of that injury. That obviously affects power and rotation and things like that. You could describe it better than me. And then 2024 right arm discomfort. I love these sayings, the discomfort and these key words that go, there's nothing there. But right arm discomfort, the issue has been a reoccurring problem, and the team had been cautious about the workload. So when you're having a young pitcher, right, that's about to make so much money in Major League Baseball, right? He's already been posted. One of these teams are gonna throw millions and millions of dollars. He's only 23 years old, but he's had an oblique injury. Now he's had this right arm discomfort, and they've had to manage his innings pitch. What are
Mhm.
some of the concerns there, especially for me, is discomfort and the oblique, which is interesting.
Yeah, I mean, oblique to me doesn't bug me too much, but the problem with those oblique injuries is not that they can reoccur, but also they're just hard to treat, right? Very few people treat them. If you tear the oblique, you can get it fixed, but it's just not that common. So generally, it's just something you kind of deal with. Maybe he had treatment, maybe he rested it, and eventually, I'm assuming
But they can
2023.
linger, right? I mean, like a Mitch
Oh
Haniger
yeah.
has had them. Like we've seen players that they've had
Well,
this
remember
oblique
LeBron?
injury.
Remember
Yeah.
LeBron James's groin for like an
Yep.
entire season. I mean, these injuries linger for months until you stop playing, right? So he had to take a break probably
Yeah.
to get the thing down, and eventually it probably calmed down. But it's a recurrent just strain, right? And they're
Okay.
they're torturous. But at the same point, it's not something you need surgery most of the time. So he got over
Right
that. I'm not as
elbow
worried.
discomfort for a 23-year-old.
That that could be, again, is it the words or is it real? Right? We all talked about this. You've seen these amazing ways they write up
Yeah.
like
Yeah.
partial sprain of the Tommy John, right? So generally arm discomfort is pretty common in baseball players, right? From even a young age, I see them frequently. They come in, they think they tore the Tommy John, they didn't. It's a flexor strain. So if this is a recurrent flexor strain, that's fine. The problem is the MRIs are only so good for seeing the UCLs or the Tommy John ligament.
Mm.
So is he having attritional partial tearing of this and not able to see it on the MRI? I'm sure he's getting the highest quality. I'm sure they're watching him like a hound. Every team that's going to recruit him is probably going to get a new MRI on him.
Oh,
Like
the
it,
medicals. Whew.
yeah, you don't want to be. He's going to have more MRIs than any of us have had in like a month as he starts getting his final contract stuff because every team's going to want their own, right? So, to be honest with you, he's probably going to be fine if a team signs him. They've done a lot of due diligence on this, but it does bother me that now he's got 2 injuries. We've seen it. It's just unfortunately it's the nature of the beast. And maybe this would be another podcast. Would be great. What makes a player resilient and what makes them not? It's just bad luck sometimes.
Yeah.
You have these players that are phenomenal, and all of a sudden they just get injured, they get injured, they get injured, they
Yeah.
get
Yeah.
injured, and then they're just done.
Yeah.
I'm not saying it's the case, but you
No.
have some of these players that are just like they never get hurt, or they just keep bouncing back. I mean, how many injuries did Tom Brady have? And he just kept popping back. He had a couple bad ones, right? Like
Yep.
that'd be a great topic to be like, what's the difference? And answer is sometimes it's not. Sometimes it's surgery. They had a surgery, didn't go as well. But sometimes it's just bad luck. I mean, you talked about Walker Buehler and his issues, right? He's had 3 injuries in a very short span, still not back. And the problem is the longer you're out, the harder it is to get back, no matter how good you are.
Yeah, that makes sense. And then you could be someone maniacal like a Ronnie Lott, where you don't want to miss a game, so you're going to cut off your finger because it's dislocated and broken, and you're supposed to miss the rest of it. Yeah, just hey Dr. Garcia, just cut it off. I got to play in the Super Bowl. Just cut it off. I got 9 other fingers. They're built different. These people built different. So we talk about it all the time. Anyway, we'll wrap it up. I hope you get a great present. I know we're going to do one more end of the year kind of recap on 2024, which should be a lot of fun. But for the holidays, for you and your family and the little ones running around, hopefully not destroying the Christmas tree or anything like that. Or if they are, just leave them. It's okay. Whatever. You buy another one next
Let it
year.
happen.
Yeah, just take it out. But I wish you guys the very best, and I hope you enjoy the holiday. I hope you get some time off, which I know this time of year where everybody's trying to get in their surgeries before their deductibles start to.
I'm going to be operating until January 1. I've decided I'm not going to leave. I'm doing this podcast for my OR.
Yeah. You're doing that. So am I. I'm in the next room. I'm scrubbing up. I'm
There
getting
you
my
go.
internal
Let's do
brace
this.
ready.
I got
I'm
you.
getting all set up.
Well, happy holidays to your family and happy holidays to all the listeners. We're going to
Yeah.
have another end of the year episode, so it's not our final one. But this was a good one just for everyone to hear about it. And this brought up a couple of good topics. I think that, what are these injuries about and why do some people bounce back from injuries better than others? There's a psyche thing. We've always wanted to have a psychologist on this show, and at some point we will, when we can find the time to find somebody. But happy holidays, everybody. Thanks again for listening. Again, follow us on all of our different ones. You've seen, we had some shout outs on LinkedIn recently with some topics. So this is exciting. There's a lot of momentum building. So thank you all.
Check us out, sportsdoctalk.com for more content, great information, transcripts, and we'll appreciate you. And I don't know about that, bringing in a psychologist or something like that. I'm going to be in tears and the episode's going to get messy, but whatever. Thank you, everyone.
Bye, guys.